StableVac, the intelligent gravity system. During arthroscopic surgery, the surgeon must adequately distend the operative joint by allowing fluid to pass through an inflow cannula and into the joint space. Surgeons must also use an outflow cannula or tubing attached to a suction instrument such as a shaver to allow fluid to exit the joint. When the shaver is activated, wall suction pulls fluid out of the joint through the shaver handpiece and outflow suction tube. Because wall suction removes fluid at an extremely high rate, the joint may lose pressure and begin to bleed, obstructing the operative view. To counter this loss of pressure, surgeons may manually occlude the suction tubing to slow the movement of the fluid out of the joint. This can lead to clogging of the suction tubing and increase the length of the procedure. Surgeons may also limit the amount of fluid outflow by using a device that allows air to enter the suction line to reduce the amount of the vacuum. By allowing air to enter this suction line, suction strength is impaired, and so is the effectiveness of the surgical instrument. Some surgeons will use an automated infusion pump to counter the pressure loss. Since infusion pumps don't control outflow, increasing pressure in the joint can only be achieved by significantly increasing inflow. The large amount of fluid needed to achieve these higher pressures results in the excessive use of fluid, which creates an extremely wet surgical environment and requires the surgical staff to constantly replace bags of fluid. This increased inflow may also cause fluid surges, resulting in extravasation of fluid into the surrounding tissues, which can cause tissue swelling and postoperative fluid retention. StableVac takes a unique approach to fluid management. Rather than increasing pressure with more fluid inflow, StableVac controls pressure by managing fluid outflow. However, unlike current fluid management systems, StableVac controls outflow automatically, without impairing suction strength or requiring multiple pump cassettes. By controlling outflow, desired pressures can be achieved without increasing inflow. StableVac can reduce fluid use by 70% when compared to procedures performed with an infusion pump. This results in less soft tissue extravasation, less fluid on the operating room floor, and a dramatic cost savings. Since a pump is no longer required to achieve the desired in-joint pressure, expensive disposable pump cassettes are eliminated. StableVac uses smaller diameter tubing to control the rate of outflow. The smaller diameter tubing creates a resistance in the flow of fluid, which reduces the rate that fluid can pass through the tubing. To illustrate the principle, imagine drinking a glass of water through a thin straw and then through a thick straw. If you were to drink the water through the straws at the same strength, you would consume the water at a slower rate through the thin straw because there is more resistance in the flow of the water. StableVac works similar to the thin straw, by creating a resistance in the flow of the fluid out of the joint. This resistance allows StableVac to achieve in-joint pressure of 81 millimeters of mercury with the bag positioned 110 centimeters above the operating site. Rather than simply connecting smaller diameter tubing from the shaver handpiece to the suction canister and risk clogging the tubing with debris, StableVac incorporates a proprietary filtering device in front of the small diameter tubing. The filter is placed inside a hard casing and in a tented shape, causing particles to flow to the bottom of the filter first. The filter's mesh material allows fluids and small debris to pass through the filter and into the suction canister. The StableVac intelligent gravity system is comprised of 2 feet of standard 6 millimeter tubing, shown with a red connector, and 8 feet of smaller diameter tubing, shown with a blue connector, joined together by a proprietary filter system. Since StableVac is used with gravity infusion, there is no need to set up complicated pump systems. The StableVac intelligent gravity system can be set up in less than a few minutes. Simply connect the red connector to the shaver handpiece and the blue connector to the suction canister. Ensure gravity infusion is connected to the inflow cannula and that the bags are at the appropriate height. StableVac will automatically control the outflow level and provide a clear and stable operative view. Pressure in the joint is determined by the height of the fluid bag. To increase pressure, simply raise the level of the fluid bag, or decrease pressure by lowering the fluid bag. To further increase pressure in the joint, the surgeon may remove the blue connector from the suction canister and allow StableVac to flow to true gravity. This will further decrease the outflow rate and create more pressure in the joint.